I'm checking the patient's orders. I do see that the doctor has prescribed that the patient receives 75 milliliters of Jeopardy. Okay. Washing my hands. How you doing today, Mrs. Johnson? My name is Tiffany today, and I'll be your nurse today. Do you mind verifying your name for me, please? Your complete name and your date of birth. Okay, great. All right, so before I begin, I'm going to provide some privacy for you. Also lifting your bed up to a comfortable height for you and myself. The doctor has prescribed that I give you a 75 milliliters of Jeopardy, your internal feeding, your enteral feeding. Okay. And before I begin today, do you have any known allergies? Okay, great. I'll need to assess your bowel sounds. Okay. I hear them pretty good. And they are normal active, which is good. All right. Now lift your head up to check your residual to make sure that your placement is good. The placement of your peg tube is in your stomach. Doing pretty good today? That's good. Alright. So before I begin, I need to add about 15 milliliters of air to make sure that your placement of the tube is in your stomach. Okay? And I need to auscultate this as well. Good. I heard the swoosh, which lets me know that your placement is good. I'll now check for your residual. Alright, I kind of got some resistance, so I'm going to stop there. Placing the tube back in the stopper so it doesn't get any air. And I'm going to measure your residual. Okay, your residual is about 28 milliliters. It's clear, thin, and it's aromatic. Alright, so I'll now pour your flushes. 50 milliliters each because the doctor prescribed 100 milliliters total. So I'll pour 50 milliliters and 2 cups. I'll also pour your actual feeding, your Jeopardy, with 75 milliliters. Right, so 75. Okay. All right. Before we begin, I need to add your residual back in by gravity. All right. All right, it's going in pretty good. I now need to flush that to maintain patency. I'll then add your actual feeding, your Jevity, 75 milliliters once again. Slowly, so it doesn't cause any dumping, the dumping syndrome. I'll then flush once again to help maintain tube patency. It concludes your feeding. I now cap this off. I'll leave you at this position for 30 minutes to an hour to make sure that you don't have any aspirations, and I'll be back to check on you. But before I leave, I'll give you my call light. All right, so give me a call when you need me. I'll also lower your bed back down. And I'll sit you up in a high phallus position to prevent any aspirations. The bed rails are locked. Both are locked. All right, and the bed is in place. Make sure I put it in place. Okay. I'll come back within an hour, 30 minutes to an hour to check on you. To get my gloves off, I'll wash my hands. Okay. So I've come back to check on the patient. He seems to my documentation, the patient seemed to have taken the feeding very, very well. There's no distinctions in his stomach. He seems to be very active. So I won't have any abnormalities to report, and that concludes the video.